Hi, Joe Alton, MD here, also known as Dr. Bones of the survival website doomandbloom.net. Co-author of the Book Excellence Award winner in medicine, the 4th edition of the Survival Medicine Handbook, plus designer of quality medical kits at altonfirstaid.com. I often get questions from people who ask, I take this medicine or that medicine for this or that problem. What do I do if there's an emergency? Well, I start off by asking, well, what did your doctor say? The response is often, I haven't really asked. Okay, who does really? How bad is your condition? I'm not too sure. I haven't really asked that either. But the doctor wants me to do this test. What's the test for? I'm not really sure, but I'm supposed to get it done. Do you see a problem here? In the movie I, Robot, the hologram representing the dead robot designer says, I'm sorry, my responses are limited. You must ask the right questions. The main reason for people being unclear about why they're taking this medicine or why they should undergo this or that test is because they don't ask the right questions, or often any questions at all. For various reasons, patients seem to be reluctant to ask medical professionals important questions, but that's what they're there for. I tell medical students that the secret to a successful career as a health provider is to give your patients the same advice you'd give a member of your family. To me, this is number one. Do no harm, the other number one. Keep up with the data, keep the patient informed in ways they understand, be objective and confidential, don't judge people, and make staying healthy a team effort. Health is indeed a team effort, one in which the patient, not the doctor, plays the most important role. One of the best ways to communicate with your doctor or other health provider is by asking questions. If you're a member of the preparedness community, you've accumulated all this knowledge, learned how to grow food, store preps, make shelters, perform first aid, and more. Why not learn more about your own health? Armed with this knowledge, you'll have a better chance to deal successfully with medical issues in tough times. It means staying healthy in situations where professional medical care might be scarce. Answers to medical questions might be simple, but sometimes they're complex. You have the right to have things explained in plain English. Medical professionals speak medicalese, but you might not. If you don't understand the explanation, ask them to describe things in simpler terms. The more you ask, the more it's clear you want to be an active partner in your care. Now, here are some questions that you should ask your doctor. What will this medicine do for me? The response might be, you have high cholesterol, this drug will lower it. Okay, fine, but what benefit will I reap from being on it? The answer might be, it'll decrease your chances of dying from coronary artery disease. That's a more logical reason to take the medicine than just lowering some lab value. What will the medicine do to me? All drugs have the potential for adverse reactions. It may be a factor as to whether you decide to take the medication, so you should be aware of them. Sometimes side effects are related to the medicine's primary purpose. Aspirin, for example, could cause bruising due to its blood-thinning effect. Sometimes an adverse reaction is unrelated to the purpose. Antibiotics, say, could give you diarrhea. Sometimes the side effect is a reason to use the medicine. For example, Ritodrine, an asthma medication, was found to be coincidentally relaxing to uterine muscle. As such, it was used for a time to stop premature labor contractions. Will this new medicine change the way my other medicines work or their effectiveness? A lot of people have more than one medical condition and see more than one doctor. They may or may not know that someone else put you on a drug. Doctors don't have some kind of medical telepathy with each other. Some are pretty smart people, but they're not psychic, and medicines can interact with each other. Together, they may have a stronger or a lesser effect, and in some cases, well, they might even cancel each other out. This test you want me to take, what are the things you're looking for? If doctors tell you to have a test done out of the blue, ask what medical issues they might find. Are there risks to this test? Which of these risks pertains to you? An individual CAT scan of the chest and abdomen, for example, won't kill you, but it does give the equivalent radiation exposure of at least 100 standard chest x-rays. Make sure you need it. Is this test really necessary? What happens if I don't take this medicine or I don't do this test? You should be aware of how the test results will impact your treatment. If a test doesn't affect the plan of action, is it really necessary? Would my condition improve if I changed my diet or lifestyle? I've had periods in my life where my weight has fluctuated. When I'm heavier, my blood pressure goes up. Staying at a normal weight keeps my blood pressure within normal range. Other lifestyle changes can significantly impact your health. Quit smoking and exercise regularly, and you'll improve your stamina. If a type 2 diabetic stays away from sweets, they might need lower doses of meds. Is there a natural alternative to the medicine you're prescribing? Well, this is a tricky one, as many conventional practitioners don't really have awareness of the benefits of medicinal herbs and other natural products. As such, they may have no more knowledge about them, or even less, than you do. But in this era of shortages, you might have to depend on natural products one day. Why not find out about what might actually work to treat your condition? For example, could natural thyroid supplements work if commercial synthetic products aren't available? Could you explain your plan for my long-term care? Is this treatment a temporary solution, or will I have to be on this medication the rest of my life? This might help you rethink medical supplies for disaster settings. Now be honest, did you ask any of these questions when you were prescribed a new medicine or told to do this or that test? If you did, good for you. Was your healthcare provider receptive to answering these questions? They should be, but some aren't. If not, well, you know what? You may have to find someone who is. In the end, the more you learn, the more in charge you are of your own life. If I was told I had some medical condition, I'd be on it like white on rice. I'd be finding out more. You should have the same attitude towards your health. Your obligation to your family and yourself is to have a plan of action to deal with medical issues in good or bad times. It's not just about having medical supplies as part of your preps. It's an actual plan of what to do if a medical problem exists and your doctor is unavailable. It's your health. Take charge of it and you'll have a better chance to succeed, even if everything else fails. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for listening. Hey, find out more about over 200 medical topics off the grid with a copy of the award-winning 4th edition of the Survival Medicine Handbook. And don't forget to check out our entire line of quality medical kits and individual supplies at altonfirstaid.com. You'll be glad you did.